Good morning. Welcome back to Open Med School. In the last sessions, we have discussed about how to take the history. Today, I will be discussing on how to take the notes. Many times it is found that students are writing down without maintaining any eye contact with the patient. So when you are taking the notes, see that the eye contact is maintained. That is very important. Then only the patient will be able to continue with their discussion. That's the number one point I would like to. Listen to the patient and then appropriately record the things which is sufficient. And then later you expand from this. So that should be the ideal way. So don't try to write down everything what the patient says. You listen to the patient and appropriately record the salient points so that you can expand it at a later time. So how to record it? So I would like to advise you to have your case sheet like this, divided into 4 quadrants. So the first part will contain the biodata. Already it might have been written there. You can write the name, age, sex, OP number, etc. there. Then write the major presenting complaints here. So ask the patient what is the complaint. Just suppose it is chest pain, right? Chest pain or breathlessness, whatever it be. So this column we can utilize for that. And this should be recorded word by word. So what the patient says, suppose the patient is telling, I have got the dizziness, you write down as dizziness. So what is the complaint? It can be verbatim, word by word, because that has got a better meaning at a later time. So the patient says in a local language, you write it down like that. There is no harm, there is no need that it should be translated to English. So that will give a better idea regarding what the patient feels. So, and many times patient may not be telling exactly in a chronological order. That is why I am advising you to make the paper into 4 quadrants. So next, after the presenting complaint, you will be taking the past medical history. You scribble down the past medical history. For example, patient has diabetes mellitus, hypertension, or whatever the disease with the duration. You can write 5 years, 10 years, and you can include the treatment also there. So we will have a rough idea regarding so scribble the notes like this. Then this column can be used for the family history, and the social and occupational social history can be written here, because many times history is not taken in a particular order. So whenever you get an important point, you can note down like in this paper in these areas, so that later you can complete the history in a better way. And again, remember that no two histories are similar. The same doctor takes the history about the same patient in another setting, the history will not be exactly same. So the importance is that not a single attempt, that is, history should not be tried to be completed in a single attempt. So the next day, if you have got any confusion or any doubt, again retake the history. So that is the second point you should remember. That is, especially when you have got no diagnosis or the patient is coming for a second opinion, rather than physical examination, take the history again. That will give a better idea. So the salient points which I would like to stress is, don't try to write it down everything what the patient says without eye contact to the patient. Maintain eye contact and scribble on the note part like this, and later once you, after examination, you form some idea regarding the patient and make a full story. So hope it was useful to you.